Hello everybody, welcome to the Thursday edition of Video Clips. Okay, so a television ad for a new diabetes drug features an overweight woman who's walking around in the town she lives in, and she tells the audience that she tries to keep up with her diabetes, but it's really hard. Therefore, she's consulted her doctor and she now takes an additional drug to control her blood sugar levels. Every time I see this commercial, I think about how it deceives people. It really isn't that hard to change your health. A low-fat, plant-based diet combined with exercise can improve and even reverse type 2 diabetes for most people in a pretty short period of time. Adopting the diet does take a little training and commitment, but it really isn't difficult. Additionally, my experience has been that when you sit down with a person who's diabetic or has any other condition and you explain the risks associated with maintaining that illness and being treated medically for it versus eating your way out of it or doing some additional things to improve your situation, people can become pretty enthusiastic about wanting to change their diet and lifestyle habits. So if we look at major risks associated with diabetes, one of them is an increased risk of cancer. For colon, rectum, bladder, and breast cancers, the risk is 50% higher if you're diabetic versus if you're not. The risk of liver, pancreatic, and endometrial cancers is doubled. In fact, research shows that about 80% of pancreatic cancer patients are either diabetics or people who have poor glucose control. Diabetics also have increased risk of coronary artery disease, stroke, peripheral artery disease, kidney disease, retinopathy, neuropathy, and cardiomyopathy. And most of the lower limb amputations in the United States are performed every year on diabetics. Now, as if this isn't enough, a new meta-analysis shows that type 2 diabetics have a 60% increased risk of developing dementia as compared to people who are not diabetic. The analysis included 14 studies and over 2.3 million people. Now, this particular study did not identify a cause and effect relationship, but another analysis concluded that hypoglycemia in response to glucose-lowering drugs was a major risk factor for dementia. And there is a tendency to medicate the heck out of diabetics right now because they keep ratcheting down the target level for treatment. This analysis was not small. It included over 1.4 million patients and concluded, quote, "Our meta-analysis demonstrates a bidirectional relationship between cognitive impairment and hypoglycemia in older patients. Glucose-lowering therapy should be carefully tailored and monitored in older patients who are susceptible to cognitive decline." This brings us back to the woman in the commercial who reports being given another drug by her doctor to control her diabetes. Diabetic patients of all ages are over-medicated. And the problem is that the medications are approved not because they actually improve outcomes, it's because they lower blood sugar or they lower A1C levels. For example, Avandia, a drug you might be familiar with, it's shown to reduce A1C levels by 1.5 percentage points, reduce fasting glucose by 76 milligrams per deciliter, and to reduce insulin resistance by 25%. So you might think, wow, that drug's actually pretty effective. But an analysis of 40 studies with over 28,000 patients showed that patients taking Avandia had 66% more heart attacks, 39% more strokes, and 20% more deaths from cardiovascular disease. I think many, if not most patients, would be pretty concerned about looking at the risks and the benefits. I don't really think that the risk-benefit ratio indicates taking the drug. Type 2 diabetes is treatable with diet, which would eliminate the need for glucose-lowering medications and the side effects that they cause for most patients. A low-fat, plant-based diet has been shown to reduce insulin needs for type 1 diabetics by 40% in just 3 weeks and to eliminate totally the need for insulin for type 2 diabetics in just 3 weeks. I mean, it doesn't even take that long to work. Patients should really be informed about all of this. They should know the risks. And even the television commercials, I know that the drug companies are required to report risks, but it's a fraction of the actual risks associated with taking the drug. And that guy at the end of the commercial rattling off all those risks is talking so fast that nobody can understand what he's saying anyway. I think patients really should sit down and look at data, like the type of data that I share with you every week in order to make decisions. Okay, now this one surprised me a lot. In January of this year, the American College of Pediatricians issued a statement expressing concern about the Gardasil vaccine. The article starts with a statement that the organization is committed to the use of vaccines as a tool for preventing disease, which means that they must really, really be concerned and believe that there are problems in order to go public with the type of information they share in this article. The reason for the concern is the potential association between the Gardasil vaccine and premature ovarian failure, or POF, or premature menopause. The article cites 2 published case report series in which adolescent girls developed laboratory-confirmed POF after receiving the Gardasil vaccine. The article notes that events following vaccines are not always caused by vaccines, but there are lots of legitimate concerns about this one. Long-term ovarian function was not measured in either animals or human vaccine trials for Gardasil, but potential mechanisms of action have been identified, which include autoimmune reactions due to the aluminum that's used as an adjuvant in the vaccine. Ovarian toxicity in rats has been documented for polysorbate 80, which is also used as an adjuvant in the Gardasil vaccine. Since Gardasil was licensed in 2006, there have been over 213 reports of amenorrhea, premature ovarian failure, and premature menopause made to the Vaccine Adverse Event Reporting System, or VAERS. 88% of them were associated with Gardasil. There were no cases of POF or premature menopause and only 32 cases of amenorrhea reported to VAERS between 1990 and 2006 when the vaccine was finally approved. When VAERS reports were narrowed down to cases in which amenorrhea occurred with no identifiable cause, 86 out of 89 cases were associated with Gardasil. An additional concern is that the problem may be much bigger than it actually is represented here. Primary care doctors are probably not aware of this potential association and not making reports. In fact, the FDA says on its website in numerous places that the reports that the FDA gets about drugs and adverse events represent about 1% of the actual events out there. The ACP reports that there were flaws in the clinical trials that might have kept the association between Gardasil and POF from being identified, including the addition of polysorbate 80 and aluminum to the placebo. Also, a significant percentage of the girls were taking hormonal contraceptives, which can mask ovarian dysfunction, and which would have prevented an increase in amenorrhea or ovarian failure into the intervention group during the trials. More recent studies looking at Gardasil are plagued with these same problems. By the way, using adjuvants and additives in the placebo is one way to make sure that there's no difference in the groups. You should have a true placebo, nothing in it. That's the definition of placebo, but the drug companies rig the trials. I mean, I used to try to be much more polite about it and finish being polite. That's what they do, and they get away with it. And 94% of the time, their drugs, vaccines, devices are approved. Based on these facts, the ACP says a causal relationship between Gardasil and these vaccines and premature ovarian failure can't be ruled out. The author, Scott Field, he's a medical doctor, reports that a study is planned to address these concerns, but it won't be finished for a number of years. And it still might not be definitive because premature ovarian failure can take a very long time to develop. In the meantime, Dr. Field has asked Merck, that's the company that makes the vaccine, the Advisory Committee on Immunization Practices, and the FDA to make known these concerns and to conduct more rat studies looking at the issue. He's also asked that the Centers for Disease Control review the VAERS reports and that primary care providers be notified of the possible link. He concludes by saying that his organization is posting the statement because physicians and patients should have access to this information in order to make more informed decisions. Now, I'm encouraged that the ACP is speaking out about the issue. This represents a huge change in an organization that has said nothing but good things about vaccines and committed to encouraging kids to get all of them. I'm also happy that they're demonstrating some respect for the rights of doctors and patients to have accurate information. This would all be terrific if POF and premature menopause were the only problems with vaccines, including Gardasil. But thousands of adverse event reports concerning Gardasil have been filed, and they've included some serious events, including death. I mean, dozens and dozens of girls have died as a result of the Gardasil vaccine. A comprehensive informed consent decision tool for Gardasil would include all of that information and also information on the efficacy of the vaccine. All medical authorities, Centers for Disease Control, the FDA, the gynecological associations, all of these practice groups recommend that women continue to get Pap tests as a means for preventing or reducing the risk of death from cervical cancer. And the reason is nobody knows that whether or not Gardasil prevents cervical cancer. Nobody knows how long the vaccine lasts. I can tell you here, I'm not going to go through the whole thing here. There are other articles in HealthBrace Library about this, but HPV doesn't cause, by itself, doesn't cause cervical cancer. So the only reason why all these organizations would be saying women still must get Pap tests is because they're questioning whether or not this vaccine really provides any protection at all. The fact that this is going on really calls into question the usefulness of the Gardasil vaccine. I have to tell you, when it came out, Gardasil was approved when the Vioxx debacle was going on, and it was called the HPV vaccine. We affectionately referred to it around here as the help pay for Vioxx, because there were so many lawsuits with the vaccine, with Vioxx back then, and heart disease and death from heart disease related incidents. So anyway, more and more people speaking out. I've got an article posted in the HealthBrace Library about a woman who actually was part of the clinical trials for Merck when the vaccine was being tested, who's spoken out and said, she hasn't said don't use it. These people aren't saying don't get the vaccine, but they're saying, you know, there are concerns. We should be looking into it. And hopefully you'll take this information into consideration when you're deciding about whether or not your daughters will get the Gardasil vaccine. All right, that's all for today, and actually for the week. Pass this on to anybody who you think might enjoy watching it, and I'll be back to you next Tuesday with more news.